Hey, it's Alicia from mobilitymastery.com, and I'm excited today to show you a no tools needed way to get into your quads and quad hip flexor fascia. So this is something I've actually used out in the wilderness at times if I needed to. For example, if I was backpacking after a long day of hiking, when I'm in my tent, we could pretend this was a, my sleeping mat and my sleeping bag here, and I might work on myself a little bit just to, take care of the work that I did that day and relieve a little tension so I feel great the next day. You could also do this in bed if you needed to. And this is just a really great alternative for getting into your quads if for some reason you have a hard time getting down on the ground on your forearms, because the traditional way that I teach the quad and hip flexor fascia release is using a foam roller where you're on your, facing the ground on the foam roller. You usually have to prop yourself up with your forearms. So I have this, I have a little disclaimer here. I have this camping pad folded up under my knee because as of the filming of this video, we're in July 2020. I don't know when you'll be watching this, maybe later, but I'm currently injured. I have an MCL tear here on my left knee, and I just need a little bit of cushion under my knee. So this is not necessary for you if you don't have an injured knee. But if you do have an injured knee and you want to get into your quads, then you could do exactly like I'm doing. I've been able to do this in bed without needing anything like this because the bed is a little softer. It's a little more forgiving. When you're on a hard surface like I am right now, the leg tends to just want to, boom, fall fully flat, right? So all you're going to use to do this is your elbow. So you're going to use your own body to get in here. But I want to say before I show you, kind of how I do this, that this might be a better way to get into the quad hip flexor area for a lot of you, maybe not everybody. But I was reminded of this technique and I was like, oh my gosh, I've been withholding this from my people. I don't think I've ever filmed a video on this, and I have intended to for a really long time, but I was actually reminded of this while I was in bed with this knee injury, and my quad was just aching. And this was at a time when I couldn't really get down on the ground to foam roll yet or get into my quads the traditional way. And I was like, oh my God, this is so good. I got to show them how to do this. So you could position yourself a number of ways, but essentially you're going to use the same side, elbow and forearm, your ulna here, this bone right here, to get into your quad. So if I were to work on my right side, I would be using my right forearm or elbow. So I'm going to be demonstrating on my left leg here. And this leg can either stay where it is, or if you want to kind of prop it up like so, that's totally fine too. So you just want to get into a comfortable position for you. And I'm going to start close to my knee and then work my way up. So I just want you to know that you can really get into any of the quad tissue here. Maybe even, a little bit towards your IT band and a little bit towards your adductor. So obviously if you're getting close to your knee joint, your kneecap, you just want to be really gentle at first. So you could even use your own thumbs and fingers to kind of palpate and find density. So you're looking for those dense spots. So I have some density right here, probably from my injury and some compensations to protect my knee. So I could get pretty close to this knee joint and then just, I can palpate with my elbow, but then I'm going to be using some just gentle back and forth movement here of my knee, or actually the whole leg. So my whole leg is kind of rotating actually from my hip. So I want that to be clear. If I were only rotating, from my knee, this wouldn't be moving a whole lot. So it's actually the whole leg. There we go. So there's a clunk, boom, boom. And you just want your knee to feel safe. So if your knee doesn't feel safe, either back off the weight that you're applying there or move away from your kneecap. But the whole point here is to compress the tissue and then shear it. So I'm gonna always prioritize whatever fascia I'm trying to release to get it to move. And the tool we're using is doing the compressing. So we're trying to compress the fascial adhesion or the density between this tool right here. So this is your ulna and the femur, your bone here in your thigh. And it's those two tools actually combined with the movement that creates the shearing effect that produces hyaluronic acid, and we're probably going to get some collagen production. And because I'm injured, this is an amazing tool that I have at my disposal here to increase blood flow and those nutrients, the collagen and the hyaluronic acid, to help repair. So I've been, you could even like get towards your IT band if you had something in here. I don't necessarily have an adhesion there, but there is a little bit of density. So I could get in there if I wanted to. I could lean into more of that VMO quad side. So we're all different. So I just want to really make sure you understand that I'm showing you what it looks like when you find an adhesion on me, and it's mostly going to be here, but you might actually have an adhesion out towards the IT band or on the inside towards your adductor here. I don't really have an adhesion here, so I can't really show you anything there, but you're looking for the same kind of thing. If you had one, it might clunk right here. So you want to, investigate the whole area, and then you're going to want to travel up. So my general rule always is, especially if you're new to fascia release and working with your own fascia, is 30 to 40 seconds per spot, and then moving on. Now you want to be really careful not to push in. So I'm not trying to like jam my elbow in there and like get it, with my elbow. I'm really just trying to lean my upper body torso weight into my ulna, and then you can use your other hand here to direct it like a seesaw or just to stabilize it. And then it's really my leg that's doing that movement. So I'm letting my leg movement move my arm a little bit with it, right? And those are some good clunks right there. So then same thing, you're gonna move up. And as you can see, I've got like 3 right here, 3 clunks, boom, boom, clunk, clunk. So I would, give it a good 30 to 40 seconds there. Now, if you're familiar with fascia release, you know your body and you don't have any kind of nervous system reactivity that might be fighting what's happening, then you can certainly do more than 30 to 40 seconds per spot. It's kind of as much as you can handle without getting sore or bruised or going into reactivity. So if it feels good to you, like this feels so good to me. I mean, my fascia just aches when it gets kind of immobilized and starting to get dehydrated, in my case right now from injury and being kind of inactive and immobile compared to my norm. So I like the way it feels. It feels really good. Now, getting up in towards the hip flexor, I just want to point out, when you start getting up in here, so I have my elbow way kind of on the outside, and there's definitely some stuff there. There's like a little clunk right there. And it's isolated to this area. So that's pretty much my quad IT band junction. And then I could move closer to the top of my quad, and there's something there too. Now, it might take some hunting around there. I'm gonna get it now. Boom. to really get it. So I want you to just understand that getting to know your body is going to take a little bit of experimentation and angling your elbow in different ways. So it might be like a lot of pointy elbow, or you might have to try something like this, or maybe it's on the inside for you and you can kind of get up into that junk in the hip flexor region. Like that's a really good spot for me. Boom, boom. Hopefully you can see that. Clunk, clunk. There's just like so much to get here actually. So my, you can see because of the crease of my pants, this is the crease of my hip, but all of this tissue here actually can get really gummed up. And so you can go pretty close to that crease with your elbow. And again, just moving your leg, moving your elbow, really trying, there we go, really trying to isolate. So now I'm like seesawing my elbow while I move my leg. And a couple things you could do that are going to be slightly more difficult for me to show you since I'm currently injured. Well, let's see what I can do here. Is you could bring your knee off the ground a little bit and kind of make a circle with it. So that's slightly difficult for me, but most of the time just that back and forth is going to do it. So there you go. I want to emphasize yet again that once you kind of get in here and get to know your body, you're going to find all kinds of stuff. So if you're not finding anything and you're new to doing this, please understand it might be the angle of your elbow is a little wrong, or it might be that you're not moving in kind of the right way. So I don't know if you were able to notice, but when my knee moves that way, my elbow moves in the opposite direction. And then when my knee comes that way, my elbow moves in the opposite direction. So it's kind of like, you know, they're moving in opposite directions to shear the fascia. So I want to stay on top of the adhesions and really get that shearing effect. And if for some reason you're not finding it that way, you could maybe just try, you know, pushing your leg back and forth with your elbow to find the adhesions. So that's totally allowed. And then once you kind of do that, you can go, okay, I'm going to lean in and then focus on moving your leg and not so much your arm. So there you go. You can do this pretty much anywhere, right? You can do it at work. Just plop down on the floor, release those hip flexors from sitting so much. Or again, you can do it hiking or, you know, anywhere you can just sit down and do this. And of course, reasons for releasing your quad and hip flexor or quad hip flexor fascia are going to be anything from potentially knee pain or pain under your kneecap to some IT band syndrome to hip flexor pain to strained groin muscles to low back pain and sciatica, to name just a few. So lots of reasons to release your quads and hip flexors. I probably don't have to tell you what those are. I think most of you landing here know you have tightness here. One thing to make sure you pay attention to is if you go into both legs, you always want to pay attention to which leg has more fascial adhesions that are more intense to release. So if there's, kind of some intensity, aka maybe you label it pain with the fascia release. If it's more intense on one side, for example, my left side is definitely worse than my right side right now, then you're going to want to do that side only or that side more than the other side. So we have a tendency to want to, do things perfectly equally when it comes to strength training or fascia release, right? So if I spent 5 minutes here, I'm going to think I should spend 5 minutes here, but actually maybe I should spend only 5 minutes here, or I should spend 5 minutes here and like 2 minutes here if there's a big imbalance left-right. So I would love for you to try this out and then share your results and your experience in the comment section below. If you happen to try this anywhere, really interesting, like out in the backcountry or in your tent after backpacking or something like that, I'd love to hear about it. That's something I want to explore more and do more videos on for you, because I love the fact that we can actually take fascia release with us into our favorite activities to make sure we're not only preventing injuries and recovering faster from whatever activities we're doing, but we have the tools at our disposal to actually eliminate a lot of aches and pains that might occur out there that then become potentially scary, because if you, for example, if you're backpacking, you have, you get some low back pain or some hip pain that feels debilitating, it's going to feel scary to hike yourself or walk yourself out of the wilderness, especially if you have to carry a big pack or something like that. So these are tools you can use without literally needing anything other than your own elbow to get some pain relief and then hike yourself out. So I love that about this. Share this with anyone you think could benefit. I look forward to reading your comments below. Thank you so much for watching, and I'll see you next time.